So today I'm going to be covering my outline for my final presentation for health promotion. Starting off with my first slide, I'm using something similar to what Dr. J presented on his template. The name of mine is The Impact of Race on the Prevalence and Prevention of Substance Abuse Among African Americans who are in the lower class. The next slide was the learning objectives, and I took this straight from Dr. J's template, as the learning objectives he has gives you a good breakdown of what to cover in your assignment and things to look for. Moving forward, the next slide, demographics and population characteristics. On this one, I covered the demographics, the economics, educational status they've achieved, and insurance. Things on demographics I included was in July of 2017, 41.4 million people in the United States were Black alone. So that gives you about 12.7% of the total population is African American. And that's stuff you should look to include on your demographic slide. Then population health disparity and impact. On this one, I found a pretty good picture that compares African Americans to non-Hispanic whites and compares how African Americans, their bodies, and how African Americans are more prone to certain problems like diabetes, coronary heart disease, having higher blood pressure, stuff of that nature. So on this one, I also included African Americans have lower life expectancy, lower socioeconomic status, and lower educational that they've attained. On to the next one, on slide 5, you want to include risk factors and social determinants for health. On this one, I put they have higher rates of poverty, which is a big reason why they have a lot more risk factors than other ethnic or racial groups. They're faced with racism and discrimination, whether it's in the healthcare system or outside of the healthcare system, and lack of insurance, which is also a big reason why my population doesn't seek the medical attention they need all the time. On to the next slide, slide 6. This one talks about cultural considerations and beliefs. For my population, being African Americans, I really looked at religion and the Black church, because that is a big thing that African Americans go to and seek when they need help or in time of need, sick, any of that kind of stuff. And the next thing was roles of family. Family tends to be a huge role in the African American culture and is a big thing that they use instead of seeking medical attention. The next slide, effective programming and intervention. Through all my research, the most effective thing I found was family-based programs, things that look more deeper than just looking at the individual. They look into their past life and if their family maybe has a reason or is a reason why they do some of the things they do. The next slide then was the summary of key points, which is just going to be a breakdown of all my slides, and it's going to give you a takeaway message for each slide that I thought was an important message maybe you should know or look up after I give my presentation.